Another common question I get asked over the phone is, how do I find the right therapist? And there's a couple of things that you may want to keep in mind. The first, which I think is probably one of the more important ones, is, are you truly open to coming in and talking about what's been bothering you? And I don't just mean like, hey, you're open to calling somebody or finding somebody on Google. I mean really having a little bit of self-awareness and introspection to ask yourself a question like, if I go and the therapist, the clinician, the psychologist gives me some feedback that will get me to be frustrated or something that I don't want to hear, how open am I to be able to at least hear that feedback and give it some critical thought? That's, I think, is by far the most important one to consider. Another one that's a common one is to think about psychotherapy as a process. This isn't something like when you go to a physician's office, you come once and then that's it. Here, it's a process. You typically spend anywhere between 6 to 12 months speaking to the same individual. So you may want to think about that it's not only an emotional investment, but also a financial one, as sometimes an in-network provider is not the one with whom you'll find the best fit. That kind of leads me into my third one, is rapport. One of the most important predictors of good outcome is, how do you connect with the clinician that you're working with? Number 4, which I think is also extremely important, to look at the personality characteristics of the individual that you're working at. And one of the things that always jumps to mind is, do you find that your therapist is kind? That might be so obvious or so simple and maybe overlooked, but from my point of view, kindness is the absolute necessity when we're working with people. So another question to ask, when you left the session, did you feel that the person was kind? If yes, that's maybe a good indicator for a good rapport going forward. And the last one, which may seem odd from somebody who has a doctorate degree in psychology to say, but I believe knowledge is important, but potentially not the most important thing to consider when choosing a therapist. I think being open, seeing it as a process and having some sort of financial and emotional investment, seeing it whether there's rapport between you and the clinicians, seeing if the clinician is kind, are really the more important aspects to how choosing a clinician. Obviously, notwithstanding the fact that you want to get a sense that the clinician is knowledgeable as well. Those are the 5 things that I would suggest you keep in mind when you're trying to find a therapist. Thanks so much. Hope this has been helpful. Bye-bye.